shoot.
Okay na.
Uy, pakita sa sila. Lisod niya. Sa IDC, lamig tag-isi. Hi, I'm Dr. Desabille, the Chief Operations Officer of IDC, the Medical Dental Society. And I've been into the practice for 4 years now. And I am 27 years old from Mandaue City originally, but now I'm residing in Bulacan, Cebu. And I think that's, aside from doing my job, doing dentistry or becoming a dentist, I love to go to workouts, do sports, and do car trailing or overlanding. I think that's everything I can talk about myself.
First question, Doc. How did you decide what to specialize?
Alright, so in our profession in dentistry, I can say, especially in the Philippines, dentists in the Philippines are jack of all trades. But good thing about in the Philippines, when we do preceptorship programs, like in orthodontics, in implant surgery, in prosthodontics, in aesthetic or cosmetic dentistry, what made me decide or to take up or on what specialization I'll be getting is first, after I'll share a little bit of a story. Since I was a clinician like you guys, I really love to become a surgeon. But right after board exam, when I passed the boards, tried to find my first job. It was not like I put up this clinic right away after I passed my board exam. I tried becoming an associate. So there was one dentist whom I talked to who went to a preceptorship in surgery as well. She herself told me that, Doc, if you really want to pursue surgery, I recommend you just find a dentist or who does the surgery program, like intensive you know. So by then I thought about it, and because Doc told me that it will take you a year or at most 2 years to finish the internship program, and when she told me about that, I was thinking that if I'll go with 2 years with let's be practical, there's no pay because you're still a student, you're still an associate, or let's say you're still an in-house resident of the hospital when you go for surgery. Second, you'll be out from Cebu, so you'll be going to Manila because or Davao, let's say, because it's the only hospitals or programs that offer that specialization. So by then, I changed the course into ortho. So I enrolled myself to a preceptorship in ortho under the tutelage of Dr. JB Araneta. And as of now, I am also enrolled under the COTS system or COT system by Doc Federico Nadella. So good thing about the specialization in our course or in our field is that it's a short course, and then there are very flexible time schedule. Let's say Saturday or Sunday, we can opt to have it. Unlike on being a medical doctor or another type of doctor where you have to indulge yourself into the residency program, into hospitals or maybe on clinics. In dentistry we have that, but it's not like more of a specialization. You have to take it very intensive, but there are short preceptorship programs that you can enroll yourself and be specialized into it. And as of now, I'm also a member of PAID, or the Philippine Association of Implant Dentistry. So by then you have, for now, my specialization will be in ortho, in implant, and in surgery as well. So again, as a dentist, as a general practitioner, we have a very lot of paths to go to. So don't limit yourself into one specialization only. We can do because the specialization in dentistry is all interconnected. So when you do surgery, you have to have a little bit background with periodontics. When you do ortho, it's also there's also association with implant or with surgery as well. So again, if you want to explore more, you want to specialize more, just go and attend preceptorship programs, or if you really want to get the degree or the specialization distinction, by then you have to enroll to a hospital by that.
Thank you, Doc.
You're welcome.
Okay, so for the next question, Doc, how do you persuade or convince difficult patients to trust you and your recommendations?
Alright, so that's a very good question. Actually, I consider in our clinic, I am considered to be the person who talks to people or to talk to any patient, like from a pedo patient to a geriatric patient. So there are a lot of consideration when you say difficult patient. A pedo patient that is always crying, that is hard to handle, that's also a difficult patient. But in terms of your question on how I persuade them, on how I let them follow what I recommend, first would be, let's go to the pedia patients first. When you do pediatric patients, difficult pedia patients, there's a so-called technique, the desensitization technique. I believe you're under doctor already, right? Not yet, no. So desensitization is a process wherein on the first session, if it is the first appointment of a patient, of the pedo patient, you tell them or you present them on what you will be doing. You will not directly do, or let's say even a simple act of cleaning, don't do anything, any procedure, cleaning, filling, extraction, to a pedia patient. So you talk to the patient, you build your rapport, you discuss to them what are you using, what instrument is this. By then, the child will be more interested and will become enthusiastic on the second appointment. So second would be, let's go to adult or mid-age. Usually for difficult patients, there are only two reasons I can see. First would be the fear or the trauma of dentists. First and foremost, if I will ask the patient, I build rapport, I take time, at least 10 minutes to 20 minutes. If it is, especially for first-time patients, even though from what classes of type of patient, from class A to class D type of patients, I give the same treatment, even though you're, let's say, you are just a low-class citizen, or you're the president of the Philippines. I give the same treatment on all of my patients. I give all the treatment plans they need. I start from the ideal one, or what's the best and ideal treatment plan for them, until I will ask them, ma'am, we can also give you a more budget-friendly approach. So if they'll ask me, Doc, this is my budget, and as much as I would love to follow what do you want for your recommendation, but this is only my budget can reach, what my budget can reach. So I make another treatment plan, I tailor fit another treatment plan in accordance to what the patient can achieve or can afford. Yeah. So again, I believe there's no difficult patient. You just have to learn how to deal with each and every patient you will encounter. Because first and foremost, you cannot expect that patient A is the same as patient B, and patient B is the same as patient C. So along the way, when you manage or when you do your practice, you have to be flexible enough. Second would be, you have to learn how to give the best treatment plan on your patient, and third would be, do not underestimate every patient. Because even though the patient will just come at your clinic and ask, Doc, I would love to have my tooth extracted. But when you discuss properly, the patient will become at ease, and they will believe you, and they will say that, Doc, do I have any other teeth or any other concerns that needs to be addressed? Then if you discuss further, the patient will be the one who will insist and ask to do it for them. So, do I answer the question?
Yes.
Okay.
Doc, how do you balance work and your personal life?
Alright. So in myself, I always impose the rule of 60-40.
So what is 60-40? 60% work, 40% play. So in the 24 hours of the day, 40% I always dedicate it to play or to my leisure time. Because when you work for almost, let's say, even more than 70% of your time in a day, when you work more than 70% of the time of the day, it will just give you burnout. It will not give you good outcomes, good outputs, and especially on us dentists, wherein we are, let's say, our bread and butter is our body, our hands, our eyes, our back, technically our whole of our body. If you don't give value onto the rest and into leisure time, there will always come a time that your body will ask for kumbaga maningil ba? No? It will ask for something back. So what are those, man? You become sick. So when you become sick, you can't go to work, you lose money. You lose the flow of income, no? So unlike if you do your schedule in a day, you do it 60% for work, 40% for leisure. Your body has time to recuperate, to cope up, and to charge up. And no matter how you work, always find time, or no matter how busy the schedule is, always find time to make a routine, to have or to give value to your leisure time. For example, I work here, I go to the clinic at 9:30 a.m. I always see to it to finish all of my patients before 4:30 p.m. If it is more than 4:30 p.m., I really stop. Unless if that patient is an emergency one. When we talk about emergency, that's not every day. Our course or our profession is an elective one. So we can move and move unless the patient is an emergency case, for example, from accidents. Second would be if the patient goes abroad or goes from, there's a timeline that you are following. So don't make it a habit or don't make it an excuse to your body that this is all patients are emergency. No. You always put a limit and you always put time schedule, follow your time schedule, make a routine, and by then I must say you will have a balanced life as a dentist. So again, 60% for work, it's up to you on how you divide it. Just don't make it more than 70% of your work. Because again, you are just once young, di na mo mabalik mo bata, no? And don't rely that your body is still young. You can still endure the pain of working 12 hours, 10 hours of leaning back. Always give time or find time, not give time. Find time to give leisure and excursion for yourself. So that's it. That's how I balance my personal life and my work life.
Thank you, Doc.
You're welcome.
What will be your advice to newly licensed dentists establishing their own dental clinic?
Okay. So, I have this quote in mind that I always come back to it. No? Every time I lose focus, I lost track on my practice. Good, better, best. Do not make it rest when the good doesn't become better or the better becomes best. So, always practice, never settle for less good. No? If, again, as I've said earlier, give your 100% always on a patient. Because if you give your half-baked performance, that problem will arise sooner or later. Patients comes back and then you'll still deal with that problem. No? And again, for those dentists who just passed their board exam, I tell you, we started together with Doc Marian. We started every good success or every success starts with a humble beginning. And I am not ashamed to share this story that way before 2018, late 2018, when we started our practice, it was not like every day we have patients. No, I tell you, there were days from 8 a.m. We had our practice before very early. No? We started at 8 a.m. to 5 p.m. Even one single patient, wala gyud mo sulod. No? So, by then, we just talk together, we magtinutukay kami ni Doc Marian, and mag-cleaning sa each other, no? That's how we started. And I even prayed to God nga, Lord, just one. Just give me one for this day. Just cleaning. And then, God hears our prayers, man son. So, never lose your, kumbaga, your grit, bitaw, your grit, no? And never lose your determination, because the start, or when you start up, it is really the hardest. But once the startup has already, let's say, murag ni hapsay na sad siya, then it will be uphill by then. And then when you're going uphill, it doesn't also mean it's always uphill. There are times you go down, but always go back to what I told you. Good, better, best. Do not make it rest until good become better and it becomes best. So, kana. Kay, to become where I am now, to where Doc Marian is now, no? It has been a lifelong struggle po na siya, no? But if again, ayaw mo pagpadaog sa problems, no? There has been pandemic and whatnot, unsa pa yung mga problems sa itabo, and we have been gravely affected, no? But nagihapon man ta. Dentists right now are still alive and kicking, no? Bisan we're still on the kanang kita gyud front runners or frontliners with the mouth or cavity gyud ta direction, no? So fear is always a state of mind. Overcome it and kana do not make it, I do not feel like you're invulnerable. Put have your limits, but always strive for the best. So as Finma says, unsa to?
Be
Be the
best
best
you can be.
that you can be. So kana. All right. So
Thank you, Doc. For the last question, Doc, what is the most significant lesson you've learned over the years?
sige.
In terms of life, siguro, or sa work, anything
Okay.
in general.
Sige. In general, no? In general. Sige. Over the years, actually, to become a dentist has been my 6-year-old dream. It was my first dental visit. No? It was my first dental visit when I chose, or when I said that in the next 10 years, what I'll be writing on my what will I be 10 years from now is to become a dentist. No? What inspired me, or what bring me up to this place, or to where I am now, is that dream. No? The dreams that you don't work on will only be dreams. So always strive, always do your best, be motivated, no? Even though we're demotivated at times, be motivated and try to reach that dream. Always try to reach for the star. Eh, kung dili maabot ang star, you fall on the moon. So, as what our teachers before, our CIs before in Southwestern as well, the academy, they always tell us, especially Doc Docor, no? Shout out Doc Docor, be the best in everything you do. Aim for the top 1, para kung dili maabot ang top 1, you reach top 10. If you did not reach top 10, you reach pasar. No? So, the life lesson that I have learned throughout the years will always be perseverance. Because when you persevere, because I tell you, I'm not the type of person, I'm not the type of clinician way before who is very diligent. No, I'm not diligent. Maybe I pass because gamay lang. Now we also have a little bit of stock up knowledge. No, stock up knowledge lang. So we have stock knowledge man po. So I'm not that diligent, but very thankful to meet a beautiful soul with Doc Marian. Because of her, I've been diligent na lang.
no?
Nulan.
I learned to study more than 2 hours a day, no? If more than an hour. All my instructors way before, they know me nga if na si Dean sa ilang klase, si Doc Dean sa ilang klase, matog yun na. So I'm not ashamed to tell you that because bisan pag matog ka, maka-answer man sad ka. No? So kana always be persevere, no? Always be diligent on what you do. Kay when you always think about being, let's say, no, kanang intelligent kita, no, but walay wisdom ba on what we do, wala gihapon tayo maabot ana. So, and one last life lesson may be always put your feet on the ground, your head high. Kay sky is the limit when you dream, but always know where you are. Be grounded as always. Be grounded. Kay success is just temporary. Doesn't always, you're not always you're not on top, no? There are times you go down. So be always reminded where ka nagikan, and then always be grounded. So that's it.
Thank you, Doc.
You're welcome.
Thank you, Doc.